Assalamualaikum. Today I'm going to talk about question one, which is it asks about what is calcification. Calcification is a process in which calcium builds up in the body tissue, causing the tissue to harden. This can be a normal or abnormal process. As you can see, there is two types of calcification, which is dystrophic. Dystrophic affects the tissue, and normal serum calcium levels characterize this calcification, while the metastatic affects normal tissue caused by hyperkalemia. Calcification has become a biocompatibility problem that affects various bodily systems. Vascular calcification causes arterial stiffness and calcium and phosphate deposition. As you can see this diagram, implants, stents, and balloon angioplasty mineralize due to biomaterial immune response, calcium affinity, or elastin collagen degradation.
After knowing the calcification, there are three approaches to solve calcification. First method would be cross-linking method. Cross-linking methods such as butylaldehyde cross-linking provide strength by preventing breakdown. Although elastin in the extracellular matrix is vulnerable, there are numerous modified cross-linking methods that involve treating the surface of biomaterial implant that do not harm the collagen or cause any surface deformation. At first, the tissue is immersed in neomycin trisulfate and buffer. After that, it's treated with pentagalloyl glucose in a carbonamide solution. The treated tissue lifted was subsequently accessed in rats for calcification for 30 days. The second method would be targeting free aldehyde. Same as cross-linking method, butylaldehyde is utilized to fix tissue for implants due to the strength given, while the remaining aldehyde in the prosthetic tissue promotes calcification. When porcine or bovine heart tissue is used to limit free aldehyde, calcium content and mineralization are reduced. Glycine, glutamate, and sodium bisulfate are reducing agents that produce a sheath base that neutralize aldehyde. For the third method, it will be the use of nanocomposite. By combining a polycarbonate urea urethane (PCU) with polyhedral oligomerine salsequicene (POSS), nanoparticle increase mechanical strength and can be used as calcification-resistant material. This composite reduces the deposition involving or porcine butylaldehyde fixed heart tissue.
For the third part, biological evaluation of the bioprosthetic heart valve based on ISO 10993-1. For the medical device categorization, it is categorized as implant medical device, where the medical device principally contract circulating blood in cardiovascular system. And for the categorization by duration of contact, it is long-term exposure, where the medical device whose cumulative sum of the single, multiple, or repeated contact time exceed 30 days. For the biological testing, we have 12. The first is thermocompatibility, where the effect of blood contacting medical device or materials on blood or blood components. For the second is sensitization, to estimate the potential for contact sensitization of medical device, materials, and or their abstract. For the third is carcinogenicity, to examine both chronic toxicity and tumorigenicity in a single experimental study described in OECD guideline. For the fourth is irritation, to estimate the irritation potential of medical device materials or their extracts. For the fifth is pyrogenicity, detect materials mediated pyrogenicity reaction of extracts of medical device or material. And for the sixth one is acute systemic toxicity, to estimate the potential harmful effect of either single or multiple exposure. And for the seventh is subacute and subchronic toxicity, which is determine the effect of either single or multiple exposure or contact to medical device. And for the eighth is degradation, shall have been provided for any medical device or medical device component or material remaining within the tissue that have the potential of degradation within the human body. And for the ninth one is toxicokinetic study, where to evaluate the absorption, distribution, metabolism, and excretion (ADME) of a chemical. And for the 10th is cytotoxicity, determine the self-death and the inhibition of self-growth, colony formation, and other effect of the cell. Implantation is to assess the local pathology effect on living tissue at both the gross level of and microscopic level of a sample of a material or final product that is surgically implant or placed in an implant site or tissue appropriate to the intended application. And for the last one is chronic toxicity, is to determine the effect of either single or multiple exposure to medical device, materials, or the extract during a major period of the lifespan of the test animal.
Bioprosthetic heart valve design proposal. There are three main components that were considered to design this heart valve. One, bovine pericardial leaflet. Second, cobalt chromium stent. And lastly, polyester cloth. For bovine pericardium leaflet, there are three properties that were considered to choose this leaflet. One, chemical properties. The bovine pericardium will cross-link with butylaldehyde to reduce its immunogenicity and calcification. Second, mechanical properties. The bovine pericardium has similar flexibility and durability to fashion natural tissue, hence eliminate the need of blood thinning medication. It also have greater hemodynamic compared to porcine tissue. And lastly, morphology properties. 3 leaflet valves mounted to the stand with purpose of mimicking the human tricuspid valve. The treated tissue also has same morphology of human tissue.
Next, the main component for heart valve design is cobalt chromium alloy stand. We use cobalt chromium alloy and the mechanical properties is has a high corrosion resistance due to the enhancement by chromium. And the mechanical properties, it is flexible stand to cushion the mechanical stress, and it is very durable and long lived. The morphology for stand is the stand frame help to stable the hemodynamic flow. The low base stand maximize coronary ostia clearance. And the last main component for our heart valve design is polyester cloth. The mechanical properties for our polyester cloth, it has a good durability and biocompatibility, and it is also and the morphology is with porous structure with aid of ingrowth of cells into the cloth helps hold the replacement valve in place, minimizing thrombosis at the same time. These are all the references that we use for our case study. And it's all from us. Thank you.